Good morning, everybody. I'd like to welcome everybody to Denver Health and Hospital Authority. I am Robin Wittenstein. I'm the CEO here at Denver Health, and we are very excited to be hosting this event today. As you may know, Denver Health and Hospital Authority has been here since 1860, not exactly in this spot, but is dedicated to providing high-quality, low-cost care to the entire region, and particularly to those who are vulnerable, who may not be insured or may be underinsured. The institution has dedicated itself to providing primary care services, predominantly to help prevent the development or exasperation of acute care conditions and chronic conditions. We work hard to partner with the state, with other providers, to make sure that patients can get the care that they need in the least expensive setting possible. But today we know that for many people who live in our region, healthcare costs continue to be a struggle. The cost of insurance, the cost of healthcare has risen, and people oftentimes are put in a position of making choices between providing care for themselves and their family and other things that they need to spend money on. So the opportunity to participate with the governor, with the Department of Insurance, the department with HCPF on ways that we can reduce the cost of healthcare while continuing to improve quality and to continue to improve the outcomes, the health outcomes for people who live in our region, is the mission of Denver Health. I am delighted by the opportunity to hear the governor talk about his roadmap and to offer to be an integral part of the work that is going to be done to continue to reduce costs. We try to tell everybody, make sure you go to the doctor, you get preventative health care so that you don't need to come to the hospital and you don't need expensive services. That is our goal, and we will partner with everybody and anybody that we can to help address that, because we hear the stories every day of people who come into our institution and are truly struggling with the costs of the care that they and their family need. So I'm delighted to be here. I'm delighted to be able to welcome the governor and to hear as he introduces the roadmap to healthcare affordability. So Governor Polis.
Thank you. Thank you so much. Well, there is a historic opportunity, thanks to the hard work of our legislative leaders this session. We have a number of them with us today. Senator Joanne Janal, who's been leading the way for prescription drug reimportation and saving money on prescription drugs. Senator Bob Rankin, one of the leaders in delivering reinsurance in Colorado, particularly saving some of his constituents in Western Colorado money and all Coloradans money. And of course, longtime healthcare champion, Senator Rhonda Fields, has joined us as well. To round out our team, I want to make sure you know Kim Bimsteffer, HCPF, and Mike Conway at Division of Insurance. And, you know, amidst all of the things that sometimes seem divisive in any legislative body, and that's the nature of a democratic republic, there's so much more that brings us together around a historic bipartisan healthcare session that will save people money on healthcare. We really are making history here in Colorado. I think whether you're Republican or Democrat or Independent, everybody who's run for state legislature, their constituents spoke with one loud voice: do something about healthcare costs. And you know what? Our constituents are right, because in 2016, healthcare costs accounted for 32% of median household income in Colorado. That means so many Colorado families spending a third of their income on health care. And Coloradans are sick and tired of being ripped off. As a country and as a state, we spend about twice the percentage of our income on health care as any other industrialized nation, and yet we're in the middle of the pack on outcomes and results. Now, taking a step back, let's also take a moment to celebrate the progress on access and coverage. In 2013, almost 16% of Coloradans didn't have health care insurance. That is now 6.5%. 10% more Coloradans have health care. But the work to be done involves saving people money on health care. And we have a long-term struggle to contend with, and we have a very specific roadmap tying in the work that our legislative champions are working on with the work of our agencies towards delivering better health care costs for consumers. This is an issue that we hope our nation can deal with again. In fact, I think it's part of President Trump's frustration that he can't seem to get Congress to do anything to save people money on health care, and he doesn't have a specific plan himself. But what that means is it's a time for states to take action to save people money on health care. And thanks to the work of our legislative champions, Colorado will be on the forefront. Look, our roadmap includes both short-term and long-term solutions. Immediate relief to Coloradans who are forced to pay too much for health care, and longer-term systemic savings in the longer term, rewarding preventative care, improving diet and nutrition, expanding access to comprehensive behavioral health services, and using data and IT solutions to drive down healthcare costs and result in better patient outcomes. In the immediate term, we are working on a number of bills. Senator Rankin, Senator Moreno, Representative Kennedy have already delivered to my desk, and I have already signed the Hospital Pricing Transparency Act. The very first piece of our roadmap to saving people money on health care. We are currently working with our champions in the legislature, many of whom are here today, to establish a reinsurance pool to prevent the highest cost cases from driving up rates for the rest of us, to deliver double-digit percentage premium decreases in our state, even greater savings in the highest cost areas of our state. We are working with our legislative champions to reduce out-of-pocket costs by improving consumer protections, like preventing surprise out-of-network billing. This is where somebody might have a bruise or a dog bite and go in and get a Band-Aid or a stitch and wind up with an $8,000 bill that they later find out that their insurer does not cover. That needs to end in Colorado. And lower the cost of prescription drugs by importing safe prescription medication from Canada, often made in the same facility, the same factory, and yet Americans are paying 3, 4, 5 times as much for the same prescription drug. That needs to end nationally. It needs to end in Colorado. We are also looking at everything we can do administratively, like negotiating to drive down the cost of health care. Very proud of our insurance commissioner, Mike Conway, for working to create and establish a purchasing alliance in Summit County, one of the highest cost areas of our state, testing innovative negotiation strategies with the state employee health care plan to bring down rates, and looking at innovative payment models at HCPF to lower hospital prices and have community engagement make care a lot more efficient. We are also looking at bipartisan legislation to create a state-backed co-op or public option to increase competition and bring down rates, to reward primary and preventative care, expanding access to behavioral health services. You can't separate behavioral health from physical health. And by improving behavioral health, we will reduce costs and have better patient outcomes. Increase access to healthy food and nutrition. That's also part of our kindergarten and preschool agenda. For many families, that school lunch and school breakfast is the healthiest meal they get. And by achieving universal access to full-day kindergarten in Colorado and expanding preschool slots by over 5,000, we will see improved health outcomes for our youngest Coloradans. We are looking to improve the immunization rate by sharing evidence-based practices with Coloradans to inform better decision-making. Reforming the behavioral health system, we'll be rolling out our specific timeline and plan next week on that. And in fact, I'm proud to announce today that a collaborative group, including public and private partners, are taking a huge step forward to transform the behavioral health landscape. By one of the emerging leaders is Vail Health, which just announced a $60 million commitment to address behavioral health, and I want to thank Kim Bimstuffer for working on that as well. We're Colorado. We're all about innovation, and many of our policies will need additional innovation waivers. We already have waivers in place for our state innovation model, which looks at treating behavioral and mental health alongside physical health, produce great outcomes in our pioneering community health clinics and others. We are also very excited about a number of other ways that we can have greater flexibility, like the Peak Health Alliance in Summit County, like the state's health care affordability roadmap in Grand Junction. And we know that different regions sometimes need different solutions. And that's why we, first and foremost, want to empower our communities on the ground to save money and deliver better patient outcomes. Another effort led by Senate President Leroy Garcia expands the scope of care for EMTs and qualified medical professionals, so people who can actually do what they're trained to do. Often saving money by having earlier action and lower reimbursement rates from providers. It's a win-win. We're looking at it across the spectrum to fully empower our nurses, our nurse practitioners, our physician's assistants, and our EMTs to be able to deliver on the patient health outcomes that they are trained to achieve. We know this is not going to be easy. As I always like to say in politics, if something is easy, it would have been done already. But it doesn't mean that our brave Republicans and Democrats in the legislature aren't willing to step up and take leadership roles, and that we in the governor's office and our appointees are as well. Our job is to deliver for Coloradans, and in doing so, we have a terrific partner in our Lieutenant Governor, now the head of the Office of Saving People Money. I'm proud to introduce the Lieutenant Governor of Colorado and the head of the Office of Saving People Money on Healthcare, Diane Primavera.
Well, thank you, Governor, and thank you all for being here today. This is one of our top priorities in our administration because we know that it's a top priority for our constituents. We hear from them every day. I'd also like to recognize a few other elected officials, senators who've joined us here since the Governor spoke. Senator Pete Lee, Senator Brittany Patterson, Senator Faith Winter, and Senator Steve Fenberg. As you all probably know by now, I'm a 4-time cancer survivor. I know what it's like to be crushed under the high cost of health care. I know what it's like to struggle as a single mom, to put food on the table for me and my 2 daughters, keep a roof over our heads, and still keep up with medical bills. I did that for many years. And after beating cancer, I became a lifelong health care advocate because I knew I wasn't alone. Too many families can't keep up. Medical bills are #1 reason people file for bankruptcy in the United States. We know that bringing down costs is absolutely essential for families across Colorado. So I want to specifically address the issue in our rural communities. In the 3 months since the inauguration, I visited rural areas all over the state, and it's the #1 cause for concern among their residents by far. Rural, privately covered residents have out-of-pocket health care costs that are about 10% higher than urban residents. People in rural and frontier communities often pay around $500 more for similar plans offered on the Front Range. And many consumers don't even have a choice. 14 rural counties only have 1 coverage option. Furthermore, people suffering from substance use disorder or mental health issues find it especially hard to get the care they need in rural communities. 51% of all rural counties do not have an active licensed addiction counselor. Every person who needs mental or behavioral health care should be able to get it when they need it, but only 25 rural Colorado counties have a licensed psychologist. So we need to make some big changes to make health care more affordable and more available for everyone in Colorado, including the 750,000 Coloradans who live in one of our state's 47 rural or frontier counties. Like the Governor said, because of our short-term and long-term challenges, we are taking a 2-tiered approach to reducing patient costs now and investing in long-lasting changes that will improve the healthcare system overall. So I'm really honored to do this work with a remarkable cabinet. We have some truly exceptional leaders in our health agencies who are already spearheading their own programs and tools to advance this work. So I want to acknowledge their important work and the work of their staff, and I first want to acknowledge Kim Bimsteffer with Healthcare Policy and Financing. I also want to acknowledge our Commissioner of Insurance, Mike Conway, and our Director of the Department of Human Services, Michelle Barnes. As I've told Jared many times, I also want to share with you my belief that all roads lead to health, and making this transformative change also requires looking across all of our agencies to make sure that we are using the most innovative and comprehensive strategies to do this important work. I'm thankful for the partnership and leadership of the cabinet and of your staff. I'm confident that we can get a lot of this done, and this leads me to my final point. It's remarkable how many of these ideas actually have bipartisan support. Hospital transparency, which we signed last week, was a bipartisan bill. Reinsurance is an idea with bipartisan support here in Colorado that has been successful in red states and also in blue states. Prescription drug importation passed the Senate on a bipartisan vote. It makes sense because illness doesn't discriminate against you because of your political party. Affordable health care affects every single one of us and is a human right. So in the spirit of bipartisan cooperation, I'm excited to be working on this issue to make health care more affordable to everyone. And now I'd like to introduce Peg Ellefson, a local business owner who will deliver remarks also. Thank you.
Thank you, Governor Polis and Lieutenant Governor Primavera, for asking me to say a few words today. My name is Peg Ellefson, and I'm a breast cancer survivor. So I know what it's like to be in the middle of an illness and have to worry about covering the costs of your care. I'm also here on behalf of self-employed and small businesses all over the country and in Colorado. We are not part of a health insurance group, so we don't get, preferred rates, and we don't get preferred networks. Small business and entrepreneurial spirit of the people that start these businesses what makes our economy thrive. In August of 2017, I decided to start my own business. I never realized how excited I would be to start my own business. The freedom of creating a business model of my own gave me a drive and passion that I forgot I had. When talking with other small business owners, the common question comes up: what do you do for health insurance? The answer is always the same. I pay a lot for premiums and my deductibles and out-of-pocket costs, and I hate it. Plus, the networks are smaller. Many providers will not take insurance that's not employer-sponsored. So we could direct pay, which is less than if it goes through insurance, but it doesn't count towards our high deductibles and out-of-pocket costs. Here's an example of what is paid by a couple who are both self-employed, i.e. my husband and I. The premiums for health, dental, and vision are $1,400 a month. Times 12, that's $16,800 a year. That's if we stay healthy. Those premiums will continue to rise as we age. Out-of-pocket costs, or the maximum out-of-pocket cost for the insurance, is $13,000. So do the math on that. That's a total of $29,800 per year if one of us gets sick. We have no employees. Someone asked me one time, is that for you and all your employees? No, we don't have employees. So that's just for the two of us. The question is, could we use some of this money elsewhere in our business? Yes. Could we use it to hire employees? Possibly. Could we use it to buy equipment, software, to create efficiencies in our business? Absolutely. Could we spend it elsewhere personally and help our economy grow that way? Absolutely. So that is my story, and as a small business owner, and I'm here on their behalf, and I want to thank Governor Polis and Lieutenant Governor Primavera for your work on helping people save money on health care.
Good morning. Thank you, Governor Polis and Lieutenant Governor Primavera. As the Executive Director of the Colorado Consumer Health Initiative, my name is Adela Flores-Brennan, and I am proud to be here today to help launch the roadmap. CCHI, or the Colorado Consumer Health Initiative, has been a key advocate for equitable access to affordable, quality health care for nearly 20 years. And that's why we're excited to see the Governor and Lieutenant Governor releasing a proactive agenda to improve health care for Coloradans. As advocates, we have proudly supported policies that expand access and affordability and improve quality for Colorado consumers. We supported the implementation of the Affordable Care Act and celebrated the unprecedented reduction in the uninsured rate that was fueled by Colorado being a leader in adopting new programs and policies like Medicaid expansion and the state-based marketplace for insurance, Connect for Health Colorado. These efforts have helped create access and affordability for hundreds of thousands of Coloradans. But we know we cannot stop innovating and we cannot stop improving healthcare. We hear at CCHI daily about how healthcare costs are affecting Colorado families as we help consumers navigate surprise medical bills, insurance claim denials, hospital financial assistance, and other complex barriers to healthcare. The issues we hear about range from an insurance claim denial that threatened a patient with over $100,000 in medical bills, to surprise out-of-network bills that stick consumers with hundreds or thousands of dollars in excessive costs, to individuals struggling to afford the prescription medication that they need to stay healthy. We are already working to address many of these challenges this legislative session by supporting surprise billing, reinsurance, prescription drug, and public option legislation. But more needs to be done to control the underlying costs of healthcare and to ensure that Coloradans can get the healthcare they need when they need it. Every day, our efforts to make healthcare more affordable, to stabilize the marketplace, and to protect people with pre-existing conditions are undermined and sabotaged by actions in Washington. We must take action at the state level to create meaningful change that continues to deconstruct barriers for consumers achieving their healthiest lives and protect Coloradans from the uncertainty at the federal level. We are really looking forward to working with the Polis administration, state agencies, and the state legislature on a comprehensive approach to ensuring that the people of Colorado can get the health care they need when they need it to maintain their healthiest lives. Now I'd like to hand over the podium to Dr. Colleen Casper.
Good morning, I'm Colleen Casper, Executive Director of the Colorado Nurses Association, and I'm thrilled to be here today, excuse me, and throw in the Colorado Nurses Association's support to Governor Polis and Lieutenant Governor Diane Primavera as they work hard to save Coloradans money on health care. One of the greatest contributors to health care costs today is avoiding prevention and early detection of illness and relying solely on treatment. Primary care and preventive services improve the quality of life and saves money. That's why we support the investment in primary care and prevention as a critical step to bending the cost curve for healthcare in Colorado. And we look forward to working on all these initiatives. Thank you.
To save money on health care, it takes us all working together. That means the legislature and the governor. It means Republicans and Democrats. It means insurers, providers, patients advocates, all rolling up our sleeves and getting to work to produce real savings for Colorado residents. And by producing savings and reducing rates, we also expand access so more people can afford health care in our state. We'll be happy to take a few questions. So I know we didn't have enough for everybody, but hopefully you got one of those, and hopefully the members of the press corps got one of these. If you didn't, Maria has a couple more. There's such overwhelming interest in reducing healthcare costs. We didn't quite print enough of these. We will make them available online as well. So this has very clear action steps. What I'm most excited about is there's a check by one already, thanks to the legislature. I've already signed the Increased Hospital Transparency Act. And I think that the others all have, again, strong bipartisan support in the final few weeks of the legislature. We're cautiously optimistic that most, if not all, of the items that are being worked on will be completed. We are a lot of the administrative and executive items underway as well. The reinsurance reforms would save people money in the very next pricing period. Items like the co-op or public option are one period out, meaning it's a year of planning and then a launch the following year. Other items have different time frames for implementation, but starting right away, I think Colorado consumers will begin to see some savings on health care with these measures that we're taking, working with the legislature. No, these are actual savings for people. Let's take reinsurance as an example because it's short term and it's very tangible. This work that Senator Rankin is working with Senator Donovan on, Representative Kennedy, Representative McCluskey, many others, will produce savings in the individual market in the very next pricing period. Now, the individual market is the most price-sensitive market that we have. It's the one that Peg talked about here a moment ago. It's people who don't work for a big company and get it from a big company. Now, we want to save big companies money too, but that's less price-sensitive in the sense that people don't see that as much. The company pays for it. It's a cost of doing business. But for small companies, for self-employed, for contractors, they either have health care or they don't based on how much it costs. And what PEG pays now with reinsurance would be reduced, depending on where you live, an average of 20% statewide is the target. The savings would be greater in western Colorado, the areas with the highest prices, Summit, Eagle, Garfield. We expect those prices to come down 28, 30% for the next pricing period. Denver metro area, 15 to 20% reductions. So that's not a reduction in the rate of increase. That's an actual reduction in what people have to pay out of pocket. And it's no surprise when rates come down, more people pay for coverage. Because while it's 6.8% statewide uninsured, the uninsured rate in Eagle and Summit County is far higher. I think is over 12% in Summit County because, of course, when rates are higher, less people can afford it. So by bringing down rates 20, 30% in some areas, it will also decrease the number of uninsured Coloradans. Well, this is the roadmap for saving Coloradans money in healthcare. Many of them are short-term items that will result in savings right away. I'm very excited. We've already signed the hospital pricing transparency bill. And we've taken a number of steps that I've talked about from the executive side internally and working with the Summit Health Alliance, including the announcement today from Vail Health around mental health, and a number of other models that we are seeking to implement from the ground up in different communities. Obviously, the timeline for items that require legislative action is the session, which means they have about 3 or 4 more weeks to complete those items. And I think many of them are on track to be accomplished. And we look forward to working on the implementation as well on as an aggressive timeline as we can. So, you know, I'm sorry. The roadmap to save people money on healthcare all works together. We need a lot of different elements to move forward. And that's why, you know, sometimes we get asked, is there a healthcare bill? Well, it turns out there are many legislative bills led by people like Senator Peterson and many others that together will have a real demonstrable impact on saving people on money. But because they affect different areas of healthcare, they have a number of different efforts. So we put those action steps very concretely here, including the one that we've accomplished, pricing transparency, the reinsurance pool, negotiate to drive down the cost of health insurance, hospital pricing reforms, reducing out-of-pocket costs, lowering the cost of prescription drugs. 20% of healthcare costs about are prescription drugs, and Americans pay 5 to 8 times as much as any other industrialized nation. And that includes medical devices as well as drugs, launching a co-op or state-backed health insurance option, realigning incentives to reward preventative and primary care rather than rewarding more costly and less effective crisis care, improving access to healthy diet, food, nutrition, exercise, improving immunization rates, reforming behavioral health systems. We'll have our specific timeline and goalposts for that next week, and supporting innovative healthcare delivery and reform models. So all of these things together need to happen. Some progress could be made with 1 or 2, but we feel taken together as a suite, presented as a roadmap, we can deliver on that promise to save Coloradans money on healthcare. One final question.
I was curious about the roadmap on how it's going to be able to help us with our seniors. The number of elderly people are increasing. Colorado's going to be in the top 4% of older workers and older individuals needing health care, prescription drugs, and in-home care. And I know you've got stuff on some of the helping to teach and expand some of the health care services. But what about the in-home care? We really need like an unveils
Yeah. So, I mean, I wish, obviously, that we could have Medicare on the table here. I'm sure our legislators could do a much better job than our federal government has done with Medicare. Just to cite one example, Medicare, the single largest payer that our country has, is prohibited from negotiating for prescription drug costs. So even the other big federal payer, the VA system, they are allowed to negotiate for prescription drugs. So one federal payer pays 30 or 40% less than the other federal payer. You know, again, we at the state level, our legislators ourselves, Medicare, the biggest payer, we have to work with them. We work around it. Thank goodness that they are paying for our seniors, but we don't have the policy flexibility to actually make changes to the Medicare system. Of course, the concerns of our elderly Coloradans certainly go above and beyond just Medicare, while that may be the linchpin of the benefits that they have in health care. And we hope that many of these reforms will also positively impact Coloradans who rely on Medicare as their main payer, many of whom have supplemental insurance, many of whom are affected by costs for their small business or other costs. So again, while the Medicare piece is outside of this equation because it's federal, we certainly plan that the reforms will work well with Medicare and benefit our senior Coloradans as well. Thank you all for attending and for your interest in saving people money on health care.